Hello and welcome. My name is Jonathan Ryan, and I am the CEO of Raices. I'm joining you today from my house. You are probably watching this from yours. It is this new shared experience that we are all currently living in direct response to the COVID-19 pandemic. We are all essentially stuck at home. We are thinking about essential resources like food, cleaning supplies, medicine. We're also all thinking about safety. We're thinking about the future and what it will look like. We're all concerned with the well-being of our loved ones, members of our community, particularly elderly people, people with pre-existing conditions, our healthcare workers who are right now on the front lines. Many of us are thinking just about how privileged we are to be able to shelter in place at home, to be able to socially distance. These are privileges that are not shared for thousands, tens of thousands of people who are in jail and in immigration detention centers across this country, specifically 37,000 people being held right now in ICE detention. We all know what experts are saying, that staying away from people is the only way to stay safe right now. This is not possible in a detention setting, nor is getting access to life-saving, critical care and equipment. This is all a recipe for a tragedy, the likes of which we have never seen in our lifetimes. And I'm afraid to say it is about to unfold right before our eyes. Today, this is what we are going to be talking about: the dire situation with COVID-19 inside of immigration detention centers. Today, we're going to be speaking with two guests. First, we'll be speaking with CRISTIAN Sanchez, a lawyer here at Raices who represents many immigrants who are currently locked up at the South Texas Detention Center in Pearsall, Texas. Then we'll be joined by Alexa Wharton-SMITH, an infectious disease expert who is helping to lead the COVID-19 response for the London School of Hygiene and Tropical Medicine. Right now, let's turn to CRISTIAN Sanchez, who is joining us from San Antonio, Texas, where he is currently working, even as we speak, on cases for people who are detained in immigration detention. CRISTIAN, thank you so much for joining us.
Hello, Jonathan.
Hi. So just for those who might be approaching this subject for the first time, could you just describe generally who are the people who are held inside of these ICE facilities, and why does our government hold people in immigration detention?
Right. So the people who are being detained right now are families and adults who have been apprehended either in this country or at the border trying to get access to the United States. And they're being detained for a variety of reasons and are trying to get relief either for their immigration status or to be released from detention.
Now, for many people who are watching, they've only seen the inside of a jail or a detention center on television or in movies. Could you just describe for people who are watching, what are the conditions like inside of these facilities? What does it look like once you are actually inside of one of these detention centers?
Not great, honestly. The people are packed into a very large room that's called a section or a tank. And it can be anywhere from 15 people or for general population up to 100 people in one room. Now, this is the room that they sleep in, that they eat in, that they use the restroom in, that they shower in. And the beds are kind of stacked very close together. They're kind of bunk beds that are diagonal from each other. And so everyone is very close together, and they eat together and use the restroom in that room and everything.
Mhm. So now, just getting to your work, before COVID-19 and obviously now during COVID-19, you have been in touch with your clients who are detained right now. Could you tell us what is going through their minds right now?
Yeah, my clients, when I talk to them, they're extremely anxious about this situation. They're very scared when it comes to coronavirus. They have access to the news, so they know what's going on, yet there's no officials have spoken to them about the situation. So they're a little bit in the dark, and it creates this anxiety that is heightened from the regular anxiety of being detained in this sort of situation, fighting for some sort of status or relief. And so my clients are pretty scared and panicked.
So now we all who are watching television are receiving all of these messages coming from the CDC, from members of the government, local, national, etc., about how to protect ourselves. Are there members of the CDC who are inside of these facilities providing assistance or information, or who can people get information from if they are held inside of an ICE detention center?
So unfortunately, my clients report that there's been absolutely uh, nobody's talked to them, not an official, not a guard, not a warden, not a doctor, not a nurse. Nobody has come to them and said, this is what's going on, and this is the way that we're keeping you safe inside. How through your detention, we're keeping you safe in this way. And this lack of dialogue communication also is a lack of any sort of changes when it comes to life inside, or how processes are being like handled inside, as far as cleanliness or care or any of those processes. None of them have changed.
So you described earlier the way that these facilities are set up. Are you saying that there's been no physical changes either in the structure or in how they are assigning people around the facilities, to your knowledge?
That's absolutely correct. The one change is a wall sign uh, that says, wash your hands for 20 seconds and cough into your arm. In at least one section that has about 80 people right now, 80 women, that sign is only in English. So it's not nearly enough, and they are not given the chance to even put these measures in place. There's no Kleenex. Although there's people who are coughing, and sneezing, there's no Kleenex. There's no antibacterial like gel that is available. No one is given masks or gloves, and so there's been no kind of physical changes, and there's been, again, no instruction about if you're not feeling well, separate yourself. If you are coughing, cough into your arm or into a Kleenex. There are no Kleenex. Or distance yourself from others. There's just been absolutely none of that.
You said that people do have access to some news from the outside. What kind of news do people who are detained here have access to? How are they able to get information from the outside world, if not through the officers who they're seeing inside the detention centers?
Right. They are aware of the situation. They get their news through televisions that are in the pods or sections, and also through family members that they speak to. So there's this really kind of, there's this, it's just not like, on one hand, they see the news, and then they see that no official is doing anything to change the processes. So they see the situation escalating outside, but there's no escalation inside as far as changes. One thing that has developed last week is that access is now being limited. It may be back. Some of my clients have reported being able to change the channel again, but for at least a period, they couldn't change the channel on the TVs. They were only set to an English movie channel. So they weren't able to get that information that they were before. And so that was one of their only accesses to information of how to keep yourself safe, how things are developing. And that was taken away from them for at least a while, which is particularly shocking.
It sounds like a very confusing situation where these individuals who are detained are getting little to no information from the people who are in control of their custody, while getting limited information from the outside, either through television or through relatives or yourself when you're able to speak with them. It's got to be stressful and very confusing. And this is all taking place, let's not forget, at a time when they have other business to be considering and thinking about, because these are individuals who are still going to court, right? They still have a legal process that they're compelled to follow during this, right?
That is correct. They're still fighting their cases, and it's been made more difficult because since they are detained, for my clients, as long as they still have these processes ongoing, as long as they're still in fighting their cases, I'm going to keep going to prep them. So we have to go over documents, sign things, file things, and so I have to continue representing them by being there physically in court or through visitation. And yeah, this is a process that's still ongoing. Detained courts are still happening. The deportation machine is still moving for these detained people.
Right. So now, Christian, you and I are both in our houses. We're not officing together at the moment, but we both do work and live here in San Antonio, Texas, which is currently under orders both by our mayor and through the county for people to remain at home. Are you saying that you are continuing to go to court and to visit your clients even now?
Yes, I am. It seems incorrect. It seems like it's a danger, but it's still happening because as long as the court process keeps going, we're going to keep representing our clients to the best of our ability. There has been changes as far as processes for outward facing. For example, for family can no longer visit detained people, which has been really difficult for a lot of families. And for us attorneys, we have to wear protective gear, like gloves, masks, goggles, in order to enter the facility. And court is also in that facility. So we have to go wear those things into court as well. But no officials, guards, staff, nobody else is wearing masks or gloves. And just like you and me, Jonathan, they also live in San Antonio. So there's also this risk that they could get COVID and bring it in, just like I could bring it in. But they're not currently wearing any of that same protective gear, and we don't know what kind of measures are being taken to keep them safe.
And so the question I would have is why we're hearing the different parts of the government are slowing down, shutting down because of the threat presented by this virus. Why is this system continuing to proceed even as we are in the middle, not even yet reaching the apex of this crisis?
Yeah, it's ongoing because it's part of this deportation machine. The courts are a way for the government to remove people from this country, and detention is kind of part of that. They kind of go hand in hand. So detained courts are ongoing. Saying that, though, that doesn't mean that we're calling for detained court to end, because just like it's a function of removing people, it's also a function of keeping, of getting relief granted and getting people released from detention. So I think we as attorneys are really kind of towing a fine line of, hey, this is unsafe for everyone, for our clients, for us. The inappropriate, not enough measures are being taken for our safety. Yet at the same time, detained court should not be closed until all people in detention are released. And that's what we're asking for as Raíces, is free people who are detained because of the danger of coronavirus. But detained court, although it seems ludicrous is still happening, it should continue because it's our way of getting people out. For example, I won an asylum with my client last week. She's out now as of Friday. So that's one less person that's in this tinderbox of coronavirus where we know it's only a matter of time. And so that's one less person. And the courts were closed. I wouldn't have been able to do that, and she would have still been there.
So it sounds like a very kind of a bind in a sense that you're in, much like your clients, that on the one hand, it's the continuation of this court that provides some kind of a fig leaf. It seems that enables the government to continue to detain people. But at the same time, it's only through this court mechanism that you as an advocate can actually potentially help someone to get released from these facilities.
That's correct, Jonathan. And it puts us in a really difficult position because I have to make the decision every time I go either to prep my client or to go to court, whether a lot of my clients are seeking asylum and they're fleeing really brutal persecution. So I have to make the decision, am I going to let them die by not representing them and them being removed or deported to a country where they will be killed? Or could I be putting them in danger, potentially killing people by bringing coronavirus to them? So it's a really, really a difficult decision that we have to make every single time we go. It's definitely not easy. And I do all sorts of measures to protect my clients when I do see them. But it really puts a really heavy pressure on us as advocates to have to make that decision.
Yeah, that sounds like a really difficult situation. I'm not sure even how kind of psychologically how you navigate that. How have you been able to kind of deal with these kinds of decisions as
Yeah,
they've come up?
it's really tough. It creates a lot of fatigue, especially for people who have a lot of um, really care about their clients and really want to get them out of this situation. It does create a lot of pressure, stress, and fatigue, worrying not just about winning the case for your clients, but also their health in this. And you know, I'm always worried about my clients' health, especially detained clients. The situation has never been good, but even more now, it's something that you're always scared because you know my clients, they know it's just a matter of time, and so do I.
Mm.
So it's
And
really bad.
since you bring up your clients and their health, can I ask you how are your clients right now? Are any of your clients sick?
Yeah, it's not a good situation at all. Several of my clients are either sick themselves. I don't know with what. Could be cold, could be flu, but they're not, or they're around other people. So they might be on the top bunk, and somebody who's coughing all night is on the bottom bunk. That's the situation for one of my clients, and they've reported that there's not sufficient procedures being taken, such as um, uh, those people aren't kept separate. Those people aren't given masks, gloves, or Kleenex. They're not instructed to cough in their elbows or whatnot. And my clients who are sick, when they have gone to the doctor, which is hard to do in detention, you need to put yourself on a list, and you won't see a doctor until maybe the next day. My clients have reported not even having the flu test done, which from what I understand is a prerequisite for the coronavirus test, but also sometimes they don't even get their temperature taken, which seems like a kind of no-brainer, but that is not what is happening. So there are people who are already sick. The situation is already really bad. Such as the food that's provided is not nutritious, low quality. You have to have already be in a really dire situation in order to see a doctor immediately. So from the way I understand it, you have to already be passed out or bleeding in order to see a doctor immediately. And I have a lot of my clients already have pre-existing issues that make them vulnerable. So it's just a really, really bad situation.
It sounds like it. I want to thank you, Christian, for the work that you're doing. Thank you very much for joining us here today, and also for what it's worth within all of this kind of dark times. Congratulations on winning that asylum case last week. We're really excited and happy for your client on that.
Thank you, Jonathan.
Thank you. And I'd like to ask you to stand by, Christian. We're going to be receiving questions from those of you who are watching and try to answer some of those if they do come in before we finish our live stream today. But next up, I'd like to ask some questions and be joined by our next guest, who is Alexa Wharton-SMITH. And Alexa is an expert on infectious diseases, and she's working with the London School of Hygiene and Tropical Medicine on their response to COVID-19. Alexa, thank you so much for joining us, and welcome.
Thank you, Jonathan.
So we've all been watching on television. We've all been getting much more expert on this than we were even just a few weeks ago. And given what we know about the conditions inside of these detention centers, what we just heard from Christian, is it likely that this virus will spread inside of these ICE detention centers?
In short, yes, very likely. I mean, we've heard about the conditions. If people don't have access to soap, if they're not able to practice social distancing, if there's overcrowding, they're eating and sleeping in very close, cramped conditions. This is an ideal environment for a virus like this to spread. We're also aware with SARS-CoV-2, COVID-19, that there can be asymptomatic spread. So even people who aren't showing symptoms, up to 20 to 50% of people who are infected may not show symptoms and still be spreading the disease. So our approach of just quarantining symptomatic patients or relying on fever and cough to identify who might be a case is just not sufficient. And these conditions really promote high transmission of a virus like this.
And you talk about high transmission. We've already begun to hear reports both of ICE officers and now people who are in detention, in ICE detention, showing positive for COVID-19. Once it's in the facility, how quickly is this likely to spread?
Very quickly. And my concern as well is because of these cramped conditions, we know that it seems that this virus has a reproductive number. That means the number of people that an infected person can spread it to, of probably 2 to 3, but even as high as 6. However, in such conditions, you can get what's called a super spreading event where it can spread much more quickly and much highly. On average, we're thinking that people become symptomatic after 5 days. But once you have a symptomatic case, it's already too late, and I expect the numbers to rise very quickly after that first case.
Now, I imagine this is not the first occasion that either ICE or others involved in detention has confronted epidemiology or the spread of infectious disease. How has ICE been able to handle in the past outbreaks of virus or other infectious disease inside of the detention centers? And how well have they done?
Unfortunately, it seems that ICE does not have a good track record, and there have been demonstrated cases of medical negligence. For example, last year, over 5,000 detainees were quarantined for a mumps and chickenpox outbreak. We also know that there have been preventable deaths due to influenza, and this isn't included in children in these detention centers. So that doesn't bode well for this current outbreak.
So, for a person like one of Christian's clients who right now today is inside of one of these facilities experiencing what we heard described, doesn't have access to PPE, what measures can someone who is in immigration detention take to protect themselves from the spread of COVID-19?
Well, they're in a very difficult position, an impossible situation almost, because if they were to follow the CDC advice, for example, frequent hand washing, social distancing, maintaining a distance of 6 feet away from other people, ideally if they had access to masks, gloves, visors, other types of PPE. However, it seems that that's not being provided, and I think on the outside, all of us are afraid. All of us are being able to shelter in place, but people in these detention centers don't have access and the resources that they need to protect themselves. So they're in a very difficult position. The best that perhaps they can try and do is to just the usual, if possible, hand washing, avoid touching your face, and try to maintain a distance of 6 feet. But unfortunately, they're in an impossible position.
So, given the situation that they're in your opinion, what do you think is going to happen?
I think there's going to be an explosion of cases in these types of centers. And we've seen that. If we look at cruise ships as an example, you have people, a high number of people in confined quarters in a very small space. This virus we know is highly transmissible. It spreads quickly and easily between people. So unfortunately, if things don't change, I'm very concerned about the kind of tragedy that awaits.
Mhm. And speaking of tragedy, what we hear about the virus is that the morbidity or death rate to the virus is around 2%. And we know that the population inside of these detention centers nationwide can be as large as 50,000 people, currently at around 37,000 people. And so at this kind of rate, that could mean 1,500 or so people potentially facing death as a result of COVID-19. Do you expect that the morbidity rate inside of these detention centers will be similar to what's found outside, around 2%?
Well, so firstly, it's very complicated to determine the case fatality rate. And often we don't know what this actually is until a pandemic has ended and we can do a full assessment of the case numbers and deaths. It can be actually much higher than that. And for different groups, we know for elderly patients, for people with underlying conditions. But even in younger groups, we're seeing, surprisingly, in the United States, unexpected deaths. But the other issue is seeking timely care. So if people aren't able to get to a health facility quickly, we know that the CDC advice to physicians at the moment is that patients can quickly deteriorate after having symptoms, and that delayed care can mean the difference between life and death. The more severely ill you are when you arrive at a hospital, the more difficult it is, and the lower your chances of survival. So if we're thinking about the detention center population, my concern is that the case fatality rate could be much higher than the general population. If they're not even able to have a temperature taken, if they're, we have the track record from ICE of this kind of medical negligence for other conditions, then I'm concerned that this could be much higher in the detainee population.
So what you're saying then is that if going by the 2% rule of thumb that we've been hearing in the media, that would lead to potentially around 1,500 more or less people potentially dying inside of these facilities. The result, given their lack of access to care, given the vulnerability of many of the people who are already in these facilities, you could see potentially more or potentially factors more people
Absolutely,
dying.
absolutely. And let's not forget the other stresses that people are under. I mean, for your immunity, it's important to have good nutrition, not be under enduring stress, sleep. All of these, the conditions sound like they're not conducive to maintaining a strong immune system, which could further compromise detainees.
So let me ask you a very simple question, Alexa. Would the immigrants who are being held in these facilities be better able to protect themselves against COVID-19 if they were free?
Absolutely. They would be able to follow the same guidance that we are able to, social distancing, access to soap and hand sanitizer, PPE where available and relevant. And I think that not providing them with that, it can mean a death sentence. And let's not forget that also we're seeing inmates and prisoners being released. And when we're talking about detainees, these people, we're not talking about criminals. They should be able to have access to the same resources to be able to protect themselves. And we're living in these unprecedented, extraordinary times. So they're essentially being denied the ability to follow basic guidance coming from the CDC on how to protect ourselves from this disease.
Yes, and certainly all people who are here in this country should have access to life-saving care, no matter their status of custody or liberty. And I too, as well as Christian, have spent a good amount of time in and around these facilities. And what I know is that many of them, in structural terms, they're very similar. If you haven't seen one, to a big box store, the construction material is almost exactly the same. And so what you have in these facilities are essentially a big box that's got 1,000 to maybe 2,000 people inside. It's almost like a densely populated urban area that's situated inside what might otherwise be a rural city or town where these facilities are located. So we know the dangers that are presented now to the people who are inside of these facilities. But when you have a structure like this that is essentially kind of super packed with people, what kind of a larger implication does that have for the public health of the people in that city? As Christian mentioned, you have workers who are coming in and out of the facility from towns that have already been identified as having cases. You have individuals who are being transferred from one detention center to another, contractors who are visiting regionally. What are the wider implications of having these kinds of facilities filled with people during a pandemic?
Well, it's an important relationship that goes back and forth. So what we know so far is there's already widespread community transmission of this virus. So essentially the people who are in these detention centers are sitting ducks. When you're having people coming and going, entering the facility, we know that there are already cases circulating in the community. They're being exposed to this virus possibly on a daily basis. And we can go to the example of the cruise ships. What happens when you set aside thousands of people and there's an outbreak? The numbers exponentially increase. And when that's a stationary structure in a community, that can also feed so that the transmission can go in both directions. My concern, if I worked at a facility like that or had to access it, would be not only exposing detainees, potentially I might not have symptoms but be infected, but also to be exposed myself and bring it home to my family and the wider community. You're creating a cruise ship scenario of high number of cases and a hot spot. It's unfortunately, this transmission goes both ways.
So you make reference, it's interesting, to the cruise ships, which may not be what people first think of as a comparison to a detention center, but it is similar. It's a large structure. You've got very many people who are inside. Yet the narrative that we hear on television around these cruise ships is the effort in evacuation and getting people out. So as we take a similar situation and apply it to these ICE detention centers, what needs to happen at the end of the day? What is a safe evacuation plan for a facility like STDC, where CRISTIAN works, or any of these other detention centers in the country?
Well, we can look to the examples of what happened initially in Wuhan when U.S. citizens were evacuated and taken to a U.S. Air Force base in California. I think it would be quite straightforward to be able to evacuate people from these detention centers, and where there have been confirmed cases, to then require a quarantine period of 14 days, and whether it's military bases or other structures that can be supported for this purpose. And if that population remains in isolation, quarantine for 14 days, they could then continue their journey onward, as we have seen from other examples, such as the cruise ships and such as US citizens who've been evacuated back to the United States.
And I would note that in the evacuation of some of these cruise ships, the Diamond Princess, for example, they used Lackland Air Force Base, which is located here in San Antonio, for that process of evacuation too.
Right. Yes.
So as we sit today, as we stand here and speak, there are 37,000 individuals who are in detention here in the United States. Other countries are also facing this pandemic, and other countries also have individuals in detention in different states. What are other countries doing that we might look to as an example here in the United States?
Well, in the face of this unprecedented pandemic, the United Nations has advised countries to release people who are detained. That even extends to nonviolent prisoners as well. And in other countries, we've seen Iran, which perhaps doesn't have the best human rights record, releasing 100,000 inmates in the wake and the impact of COVID-19 on their population. Italy has also adopted a decree releasing inmates. And I believe now in the United States, including in California, this is a consideration. I mean, we're operating in extraordinary times. And with the detainee population, again, we're not talking about prisoners, people who've come to this country seeking a better life. I really think that we should follow the example and do everything we can each hour, each day that this population is exposed, and they are being exposed to this virus, which has become very widespread in the United States. It puts them at risk of a human tragedy, and being a detention center shouldn't be a death sentence.
Thank you, Alexa, for your work and for your information here today. And I'd like you to stand by as well. We have been receiving some questions from our viewers as we've been speaking, and some of them are directed towards you. So I'd like to now turn to our viewer questions. The first one that we have here is for CRISTIAN, and our questioner asks whether we know whether detainees are still being brought into these detention centers at this very moment, and if so, what precautions are being used for them and the already detained population inside.
That's a great question. People are still being detained. New people are still being detained. The procedures that are being done to keep them safe, or people who are already being detained safe, could vary from detention center to detention center. But at the detention center I work at, my clients are telling me are pretty upset that there's new people being detained because they're scared that they could be bringing in coronavirus, just like they're scared that the guards and wardens and officials could be bringing in coronavirus. And they're reporting that the new people are saying that they are kept quarantined, but for only 2 days. And I think we know, I mean, Alexa knows this too, that it would just be 14 days is minimum for quarantine to protect other people from coronavirus, but it's just 2 days is what is being reported. In addition, they're saying that they're not getting their temperature taken or any other sort of test or screening to protect, to make sure that they're not bringing in coronavirus. So people who are already detained are pretty upset, and new people are reporting that these measures are being taken, but they don't seem to be enough.
Alexa, do these sound like sufficient measures, what Christian is describing?
Absolutely not. And not only that, but there just needs to be testing. We need to know where we are with this to be able to successfully manage cases and prevent deaths.
Mm-hmm. And one final question has come in for you, Alexa, based on something that you said earlier. You mentioned the possibility of, I think you called it a super spreader event with an explosion of cases that could come in time. Our questioner remarks that this sounds terrifying and that we all have a great sense right now of the need to act fast in general. But could you speak to the timing and sense of urgency with respect to these immigration detention centers? What might acting soon mean in terms of everyone's safety?
Well, what we already know is that there have been 6 confirmed cases in detention centers of detainees, and that's in 4 different facilities. This information is available on ICE's website, as well as I believe it's 5 confirmed cases in ICE employees. So it's already, we know that it's already in the detention centers. I think something that we've seen happen in the United States is due to a lack of testing, we're only seeing the tip of the iceberg once cases become severe or symptomatic, and by then it's too late. This has already been transmitted. We know that people are spreading this disease before they're showing symptoms. And so the need for urgency is very, very strong, as quickly as possible to really get a handle on this. Otherwise, we're going to see what we've seen happen in other cities. You know, the CDC had all of these resources at their disposal to attempt to contain the first imported cases that we saw in Washington, for example. And even with all of their resources, were unable to do so. They were unable to contain the spread of this disease. So you put this population into these crowded conditions and creates essentially creating these super spreading events. So where you have one case, there will absolutely be many more cases than we're aware of. And unfortunately, that has terrible implications down the line.
Alexa and Christian, thank you both so much for joining us today.
Thank you, Jonathan.
Thank you.
Last week, Raíces filed a lawsuit aptly titled OMG versus Wolf to immediately free our clients at the Carnes Family Residential Center, as well as those who were being held at the Dilley and Berks, Pennsylvania Family Detention Centers, under the grounds that ICE cannot provide the care needed, and the massive outbreak in detention would be a further strain on local healthcare systems. On Monday, our legal team had a temporary restraining order hearing with the federal courts, which was partially successful, but did not result in the judge ordering the immediate release of all families from these detention centers. 37,000 people are locked up in detention centers across the country. Many are run by private prison companies like Geo and CoreCivic. These companies make huge profits, money that is made simply based on the number of people that are detained in their facilities each additional day. Considering how serious the threat of COVID-19 is, and that a massive outbreak with a high mortality rate is a foregone conclusion, why does the government refuse to release these people who are literally sitting ducks, waiting for a deadly virus to attack them? We all remember how outraged we felt as a nation when our government separated children from their parents at the border not even 2 years ago. It felt like an impossibility. How could our own government, the government that is supposed to be built around shared values and principles, how could they do something so intentionally cruel and dehumanizing? It felt counter to everything that we stand for as a nation. Well, we're in that situation once again. We are on the verge of crossing a threshold from which we may never be able to return. If we do not pressure our government to release every immigrant locked up in a cell before this virus takes hold, then the unthinkable will happen, and it will be too late. But right now, as of this moment, it is still possible to change course and to remember that we are all in this together and that we are only as healthy as the most immunocompromised who live among us. The World Health Organization has said that none of us is safe until we are all safe. And the key to getting there is to avoid creating disaster spots with incredibly high infection rates. The only way to avoid that happening in immigration detention across this country is to free them all. We are issuing this direct call to action here today to see how we can all work together to push our government to do the right thing and release everyone to safety. Please go now to our website at the address below, which is riasistexas.org/COVID-19. We'll be updating this over the coming days with more resources on what everyone can do in the fight to free those who are still detained. Thank you so much for joining us today. Thank you again to my guests. Thank you for watching, and we will be back with more information. Thank you.